have learned over these ages. So there has to be that adaptive feeling and also capacity building of our own staff to accept this new technology. And naturally, any new change, there is resistance, so we have to be ready to accept that change and overcome the resistance. And also, it has to be cost efficient. That's why when we talk about low cost, homegrown technologies because it is not necessary that if something works in New York, that does not work same in Nagaur. So let us evolve new technologies which are area specific and work on it. Uh, Talking about enabling environment, whether we talk about international level, national level or state level, we all have our enabling provisions when we see it globally. The WHO Innovation Hub focus is a global platform which aims at fostering and accelerating health innovation and focusing on leveraging new technology and innovation to address global health challenges. So that can be seen as a context. Also, the Eureka Innovation Space, which is an intergovernmental organization focusing on research and development based on market trend. Then our own domestic, we have Lead Innovation Challenge, which encourages startups, researchers and innovators to develop groundbreaking healthcare using technologies and services. At national level, I've already spoken about ABDM, which is the main focus of Government of India, Government of Rajasthan, making use of e-health records, personal health data, interoperability and its accessibility. Then we have our promotion, research and innovation in pharma medtech sector, which is again a GOI initiative focused on innovation in pharma sector and which fosters collaboration between academia, industry and government. Rajasthan, as you might have seen, our Mukhyamantri Ayushman Arogya Yojana, which is totally digital driven, which is cashless, faceless scheme. In this year, if we talk of calendar year 2024, almost 16 lakh, almost 17 lakh people have benefited and government has spent almost 2,800 crores giving health insurance coverage to its 1 crore 33 lakh people. And with Honorable Prime Minister declaring on 29th of October that any person in the country above 70 years of age is covered under it. So, Government of India gives a health insurance coverage of 5 lakhs, but here, under the direction of Honorable Chief Minister and Honorable Health Minister, we are extending the health coverage of 25 lakh to anyone who is 70 years. He may not be an NFSA beneficiary, he might not fall into any of the categories, but because of the vision of Honorable Prime Minister that we need to focus on geriatric care, this new factor has been added. We have included daycare packages of cancer, almost 70 daycare packages are there. So every day we are learning from the market, we are learning from the aspirations of the people and trying to accommodate just to address the needs of the people and also making it strong technologically. I have a lot to say, but we have to listen to the panelists, the distinguished panelists. So, by and large, today's panel discussion will be focusing on technological advancements and innovations in healthcare, government policy initiatives, and building a robust health infrastructure for sustainable future ecosystem. And I hope we have an animated discussion. We get a lot of suggestions from you people. And this session is not the end of all the discussion that we have for Rising Rajasthan. We are here after the session. After tomorrow, every time we are here, we'll leave our emails with you all. You can always approach us, connect us, and our overall objective is to make health accessible to all, to make health affordable to all, and to make ease of accessing health services available to every common man in the state. And I hope with your partnership, we can take it further. Thank you very much for a patient listening.
Thank you so much, madam. That was really nice when the stage is already set, the context is already set by you. And I'll start with the three things which you said: accessible, affordable, acceptable healthcare and delivery system. And at the same time, you said about technology, which has to be low cost, adaptable, a balance between innovation and regulation. And let us hear now, let's start the panel. As you very rightly said, that we'll be looking forward for three important discussion areas when we have our discussions with the panel of experts. So we have the first panelist with us today, Ms. Meenakshi Nevatia, Country President and Managing Director Pfizer India. And she's the Country President for Pfizer, as I said, and prior to joining this, she has been the MD for Stryker India. So let's hear from you, madam. When we say about the pharma sector, we claim to be that the Indian pharma sector is the 20% global share in the entire pharma sector of the world. But when it comes to how much we are spending on the R&D, it's just 5% of what United States spend, and we say 1/5 of what China spends. Let's hear something from you on a broader way. What are the research and innovations in pharma sector which you are seeing in the current scenario? Over to Ms. Meenakshi Nevatia.
Thank you, Professor Pankaj, and I just want to first acknowledge what Gayatri ma'am said, that just from our perspective, as we look at the pharma sector, the number of advancements in Rajasthan, whether it's to do with awareness, whether it's to do with infrastructure. I was just recently at the SMS Oncology Center. That's like a whole city coming together, because what they're trying to create is extremely visionary, and we are very excited to be a part of this. So how do we, I guess your question is, how do we see innovation, right? And I think I just want to put it out maybe in three different buckets. I think the first and foremost, particularly some of the global pharma companies, of which Pfizer is one, we definitely see one of our biggest responsibilities is how quickly we can get the innovative therapies into the country. In the past, because we were not doing clinical studies in the country, or because the process of approval was much more prolonged, it would take almost 7 to 8 years between a launch in the US and a launch in India. And we are really, all of us, trying to crash that timeline to be, maybe in 2 to 3 years. So our most recent launch, we launched within 2 years of US launch. And that's only possible if we can first tackle the data generation. So a lot of our companies, including Pfizer, are looking to do clinical studies in our country so that we can have the data that regulators need to show efficacy. The second is make sure it's accessible, because launching is one thing, but it needs to be affordable, it needs to be accessible. So a lot of thinking is going into how we make that happen. So that is, I think, the first bucket of innovation that we think about when we think about, how to bring the innovative therapies into our country. The second is the whole area of, diagnosis, awareness, affordability, which a lot of the companies, including both global as well as Indian companies, are spending a lot of time thinking through how do we get that awareness at the right time. So I'll just share one example with you. We do a lot of work in cancer awareness, including having help desks in SMS and many other places in Rajasthan. And what we find is increasingly the ability and the desire of state hospitals, including in Rajasthan, to have these help desks so that people can diagnose quickly, because quick diagnosis has a very different prognosis to late diagnosis, particularly in cancer. So I think a lot of energy is going by the state, like Rajasthan, but also by companies like ours and many others, on driving innovative ways to get diagnosis. For example, home diagnosis, or there's so many different ways that you can do it. So that's, I think, the second big area. And I guess the third, and maybe we'll talk about it more through the panel, is Gayatri ma'am, we talked about low-cost homegrown technology, right? And what we are finding is that there are many startups with many, many good ideas, but more fail than succeed, because it takes, firstly, it takes a lot to come up with a breakthrough idea. But secondly, particularly in the sector of healthcare, to design, to develop, to validate the technology, it's a lot of knowledge, it's a lot of time, it's a lot of investment, and that's where a lot of good ideas fail. So one thing that we have taken up very actively in the last 2 years is the concept of the Pfizer Innovation Fund. And what we do is at every point we are funding at least 6 startups just based on grants, to really not just give the money. Money is in a way easier thing to access, but much more the support and infrastructure to take an idea from its birth to actually seeing its logical conclusion. And we are seeing some phenomenal Indian startups coming up in that area, whether it's the most recent one is an AI-based stethoscope that can diagnose murmurs that many other normal stethoscopes cannot. Similarly, cervical cancer screening at home, because a lot of women do not want to go into clinics and get that, the smears done. So a lot of ideas that will really bring the technology to the home, to make it much easier for our populations to access it. But it's a long journey to getting there. I think we are just getting started. But that's the other way I feel companies like ours can really contribute.
Thank you so much. Thank you so much, Dr. Meenakshi, for setting again the context. And from your idea, I could come up with what you said about data generation, affordability, diagnostics, low-cost, homegrown technology and innovation solutions. But you also spoke something about that sometimes companies like yours feel that government is not that, very promising when it comes to giving a kind of a helping hand or let's support you in this system. And I'll take the next question from the same idea, and I'll go to Dr. Vibhav Garg, who is the Director of Health Economics and Government Affairs in the Subcon UGM Boston Scientific. Over to you, Dr. Vibhav. In September 2023, if we all remember, Government of India launched National Policy on Research and Development and Innovation in Pharma Medtech sector, and we call it by the name of PRIT. And I think we boast of that, being in an academic institution like AIMS. When we had our PG classes, we used to